Today's topic for presentation is treatment plan. So treatment plan is discussed under the following headings: overall treatment plan for a patient and sequence of periodontal therapy, explaining the patient how about the treatment plan, and conclusion. So after the diagnosis and prognosis is established, the periodontal treatment is planned. So it includes immediate treatments, intermediate treatments, and long-term treatment goals. So immediate treatments generally eliminate all infectious and inflammatory processes that cause periodontal and other oral problems that may hinder the patient's general health. So the goal of immediate treatment is to bring the oral cavity to state of health, and this involves the patient education on infectious oral diseases, prevention of these diseases, periodontal procedures, endodontic procedures, oral surgical procedures, and treatment of oral mucosal pathologies. So, referral to other specialties of dental and medical may be necessary. So, in this establishment of treatment plan. And from the periodontal point of view, when you talk about treatment plan, the immediate goals involve the important part, and because they consist of elimination of gingival inflammation and the correction of conditions that cause and perpetuate it. So these include not only the elimination of root surface accretions, but also the pocket reductions and establishing good gingival contours and mucogingival relationships conducive to periodontal health. So immediate those are the goals of immediate treatments. So intermediate goals involve the reconstruction of healing dentition that fulfills all functional and aesthetic needs, and this involves the other dental specialties as well as the age, health, that is general health, and desire of the patient to undergo treatment. So this may span somewhere around months to years of treatment sometimes. So long-term treatment goals involve the maintenance of health through prevention and professional supportive periodontal therapy. So once an active disease has been controlled, so all infections and inflammatory processes have been eliminated and health is been attained and should be maintainable for the rest of the patient's life. So this depends on the disease prevention, meticulous daily patient care, and patient adherence to professional recalls and maintenance at regular intervals. So coming to the treatment plan in periodontics is a blueprint for a case management. So it is an organized approach of comprehensive treatment based on patient's oral, dental, and periodontal needs. So except in emergencies, no treatment should be started until the treatment plan has been fully established. So the decisions involved in treatment plan include emergencies or emergency treatments, which involve pain and acute infections, then removal of non-functional and diseased teeth, to facilitate prosthetic reconstruction, pocket therapy, occlusal correction, temporary restorations, and final restorations, endodontic therapies, surgical and non-surgical periodontal therapies which involve resective and regenerative therapies. So, caries prevention or removal of caries and temporary restorations and final restorations, occlusal adjustments, and decision regarding aesthetic considerations in periodontal therapy and sequence of therapy. So, the master plan for periodontal therapy, for total periodontal therapy, involves the following rationale. So, elimination of pain, gingival inflammation and bleeding, reduce pocket and eliminate infection, arrest purulent exudates, destruction of soft tissues and bone should be arrested, and reduce abnormal tooth mobility and prevent recurrence of disease and reduce the tooth loss, correction of etiological factors and establish optimal occlusal function. As I have told you before in the previous lectures, so the decisions are made based on diagnosis and prognosis. So, treatment decisions are dependent on diagnosis and prognosis of an individual and overall dentition in mind. So, as such, the diagnosis and prognosis will change with treatments. So, and in some unforeseen conditions, some modifications of initial treatment plan is allowed. And coming to the actual treatments in periodontal disease, so we have something called periodontal evaluation. When periodontal evaluation shows no attachment loss, then the patient, when the local inflammation is present, it should go for oral prophylaxis, and generalized moderate to severe inflammation is present, it leads to scaling and then reevaluation and then go for oral prophylaxis. Oral prophylaxis is something where you establish the oral health by treating various aspects of diseased tissues. It can be the gingival tissues, it can be dental tissues. And when attachment loss is present, so you proceed with scaling and root planing when disease is present, disease is not under control. When disease is under control, it goes for only the periodontal maintenance. And scaling and root planing, after finishing scaling and root planing, go for reevaluation and then reinforce the oral hygiene instructions. And after evaluation, you proceed with periodontal maintenance when there is excellent hygiene and the disease is resolved. So, when excellent hygiene and unresolved periodontal pockets are present, that will go for surgical therapy in periodontals. And then when poor oral hygiene is maintained after during the reevaluation, then non-surgical therapy is reinstituted and reevaluation is again repeated. So, to simplify this particular explanation, we have something called preferred sequence for periodontal therapy, where various phases have been explained. So, the first phase of therapy in periodontal treatment goes for non-surgical periodontal treatments. So, before non-surgical periodontal treatment, even though periodontal non-surgical treatment carries a phase 1 tag, we have something called emergency phase. When there is an emergency treatment which is required, that is the reduction in the acute condition, so you go for emergency phase of treatment, where it is not instituting the non-surgical phase of therapy. So once the emergency, that's acute pain, is subsided, then you can proceed with non-surgical phase of treatment. So emergency phase involves, what does it involve? Emergency phase involves control of acute lesions, painful lesions, extractions. These things will come under emergency phase, that is acute pulpitis, where it cannot be managed with by an endodontist, can go for extraction. So once the emergency phase is over, the first phase of therapy starts in periodontal disease. That is, the emergency phase need not be present for all cases. It's only for where there is a need, the emergency phase appears. Okay. So otherwise, in a general patient, so you go with phase 1 therapy, that is non-surgical periodontal therapy, which is also termed as etotropic phase of treatment or preliminary phase of treatment. And this particular phase of treatment involves the elimination of etiological factors. So although these phases are numbered, that is phase 1, phase 2, phase 3, these numbers will be there, but the sequence keeps changing based on the need. So phase 1 therapy, as I said, it involves a non-surgical phase of treatment, that is directed to the elimination of etiological factors of dental, gingival and periodontal diseases. So which successfully performed, when it is successfully performed, this phase of treatment stops the progression of dental and periodontal disease. So what does this non-surgical phase or etotropic phase involve? All the etiologies. It can be calculus, plaque, it can be the high filling, it can be any other dental related dental related abnormalities which becomes an etiology for periodontal disease, come under non-surgical phase of treatment. So intermediately, so after completion of phase 1 treatment, the patient should be placed on the maintenance phase, that is phase 4. So phase 4 comes after phase 1, that is phase 1 is etotropic phase, elimination of all the etiologies which are related to periodontal disease, and then patient should be kept under maintenance phase of treatment, of maintenance recall phase. So that is to preserve the results obtained and prevent any further destruction and recurrence of disease. So while on the maintenance phase, with the periodic evaluation, the patient enters into surgical phase of treatment, that is phase 2 is surgical phase and phase 3 is restorative phase. So when the patient is on maintenance therapy, so they can get into surgical phase or restorative phase of treatment. So that is phase 2 or phase 3 type of treatments. So these phases, that is phase 1, phase 2 and phase 3 treatments include periodontal surgery to surgical treatment to improve the condition of periodontal and surrounding tissues. And this may include the regenerative treatment for gingiva and bone, for good function and aesthetic placement of implants, and restorative therapy. And so once you plan your treatment, so you should and you need to know where exactly you need to position these treatments. This is a figure so which shows a sample time line. So following phase 1 therapy, and the patient is placed on periodontal maintenance at regular intervals between surgical and restorative treatments are scheduled between periodontal recalls. So the preliminary phase or the etotropic phase involves dental and periapical lesions or emergencies, periodontal emergencies and others. So extraction of hopeless teeth and provisional restorations, if needed, may be postponed to more convenient time. So this is the picture where you involve the emergency phase of treatment. The first picture shows the interdental craters, that is on the gingiva, that is punched out ulcers in the interdental papillary areas, which represent the acute necrotizing ulcerative gingivitis. So this the main feature of this particular disease is it's absolutely painful and acute pain will be present. The patient will not allow anybody to touch his gums, and he will not be able to even the air comes and touches also, the patient feels pain. So such type of symptoms have to be subsided so before starting the phase 1 periodontal therapy. So non-surgical periodontal phase of treatment involves scaling and root planing, patient education and oral hygiene instructions. So diet control in patients with rampant caries, and correction of restorative and prosthetic irritational factors, and excavation of caries and restorations, antimicrobial therapy, local or systemic, and occlusal therapy, minor orthodontic movements, and provisional splinting and prosthesis. So non-surgical periodontal phase does not involve only the periodontal treatments like scaling. So oral prophylaxis is one of the part of scaling and root planing is one of the parts of phase 1 treatment. So otherwise the phase 1 treatment involves the various treatments which are the etiology for causing periodontal disease. So this is the picture where you can see the gingivitis in the papillary marginal areas. Right? So it is diagnosed as marginal and papillary gingivitis. It is chronic gingivitis which is caused only due to the calculus and plaque, that is primary etiological factors. So once you eliminate that particular thing, so you should keep this particular patient under maintenance phase and re-evaluate the patient for the response of non-surgical phase. So after 4 to 8 weeks, one should recall the patient and re-evaluate for what? So for the access for the response of the phase 1 treatment what you have given. This is to assess the tissue response to therapy and to assess the patient compliance to oral hygiene instructions. That means when the doctor is giving the instructions, whether he is following or no, you have to reassess and assess the need for further periodontal therapies. Pocket depth should be evaluated and gingival inflammation should be evaluated whether it is controlled, and plaque and calculus and caries should be assessed and further action need to be taken. Okay, and along with this we need to check the pocket depths, plaque scores, bleeding on probing, caries, occlusal stability, mobility, fremitus. I hope everybody has an idea of what is fremitus. So fremitus is something where there is the occlusal interference. So the vibrations are felt when the patient is asked to occlude his teeth in centric occlusion. So if trauma from occlusion is present, the fremitus is felt, that is, vibrations are felt on the labral surfaces of upper anteriors. So that gives a fremitus positive. So mucosal health status has to be re-evaluated, and then mucogingival status has to be evaluated. Systemic status, radiographic evaluation, the oral malodor and taste should be taken into consideration. Aesthetics and modification of phase 2 treatment plan has to be implemented. So phase 2, what do you mean by phase 2 treatments? Phase 2 treatment involves the surgical phase of treatments. So periodontal therapy includes, in phase 2, periodontal therapy includes flap for debridement, resective and reconstructive washer surgeries, periodontal plastic surgeries, implants, and endodontic therapy. These will come under phase 2 treatments of periodontal treatment. Okay, so here is a case where you can see the first radiograph. What you see here shows the furcation involvement, and the adjacent tooth shows there is some amount of periapical resorption, root resorption. Okay, so you need to identify what is this condition. This is either related to perio or whether it is related to endodontics. So the treatment plan involves which treatment has to be carried on first. So once the endodontic treatment is completed, that is, root canal is obturation of root canal is done, so you can see some amount of regeneration which has taken place, and then the furcation area after the periodontal treatment appears like this. The complete regeneration occurs, so in which the decision whether to do endodontal treatment first or periodontal treatment first. So both the treatments have to be completed. Once it is completed, the complete regeneration occurs. So this is a case where you can see some amount of gingival recession which is associated, and there is some amount of missing teeth in the lower posteriors. So what should be the treatment plan for this particular thing? So after the phase 1 periodontal non-surgical therapy, so you should go for surgical therapy where you can involve the replacement of teeth and root canals for the upper teeth, and replacement of teeth comes under restorative phase of treatment if the patient is willing to maintain a good oral hygiene and following all the instructions, then only you will be proceeding with such type of treatments. And there is some amount of supra-eruption which has taken place in the first molar, where you can see if the replacement has to be done, so it should be taken care in a proper manner. And it is caries also, and you can see the radiographic view of the caries. So once the healthy dental tissues are taken care, the dental tissues become healthy, that is, the filling is done, then you can proceed with the periodontal treatment here, because periodontal treatment, periodontal surgical treatment comes at a later stage after that is in phase 2 periodontal treatment. So after finishing the surgical phase of treatment, there is the next phase, that is, even after the surgical phase, you need to go for again the maintenance phase, that is the continuous process which should be maintained to maintain the health of periodontium. So restorative phase of treatment involves final restorations and fixed and removable partial dentures, evaluation of response to restorative procedures, and periodontal examination. So evaluation of phase 3, that is the restorative phase, involves oral hygiene status, pocket depths, gingival inflammation, attachment level, and restoration status. Then the fourth phase starts as maintenance phase, that is periodic rechecking, plaque and calculus evaluation for the presence of gingival conditions, that is pockets and gingival inflammation, occlusion and tooth mobility, and other pathological changes. So there are 4 phases of periodontal treatment, one should remember. That is emergency phase, which does not have any number. So phase 1 treatment involves the non-surgical periodontal therapy, and it's also, that phase is also named as etotropic phase or the preliminary phase of treatment, right? And the second phase of treatment involves a surgical phase of treatment, and third phase is restorative treatment, and whereas fourth phase is maintenance phase. So after non-surgical periodontal treatment, that is phase 1 treatment, so your phase 4 treatment will start. When the patient is in phase 4 treatments, it will either go for the surgical phase or restorative phase or both, and then intermittently following the phase 4 therapy. And after completion of phase 3 treatment, you have to go for phase 4, that is maintenance phase. The continuous maintenance recalls have to be followed for years together to maintain the life of tooth throughout the patient's life. So the next thing what I am explaining is how to explain this treatment plan, because you talk so much on phases of treatment, this treatment, that treatment, but how to explain this particular phases to convince the patient. So one should be very specific when you are telling the patient. So tell your patient that you have gingivitis or you have periodontitis, and explain about the condition and how they are treated and how they respond for the treatment, and after what treatment will be given. And begin your discussion on a positive note always, and avoid vague statements like, do not begin with statements like the following teeth have to be extracted. Don't come to a conclusion that following teeth will go for extraction. Okay, so first tell the patient in a positive note that it can be treated. Then emphasize the important purpose of treatment is to prevent and other teeth from becoming as severely diseased as the loose teeth. So that's the reason you can advise, you can give that reason and advise the patient for extraction of that particular tooth. So present the entire treatment plan as a unit. So avoid creating an impression that the treatment consists of separate procedures and it will take so long. So some or all of which may be selected by the patient. Okay, and make it clear that the dental restorations and processes contributes as much as to health of the gums as the elimination of inflammation and periodontal pockets. Okay, so they are very important to maintain the periodontal health. That's what should be the dictum what you need to dictate the patient. Okay, and coming to conclusion, so we have something called health of oral cavity begins with the patient education about infectious diseases and its etiologies, treatment and prevention. So a good treatment plan can be established after a thorough examination, diagnosis, prognosis, and the patient desire to undergo treatment. So diagnosis and prognosis will change with therapeutic needs, hence the plan of treatment changes accordingly. So that finishes the treatment plan. So here is a case of a periodontal abscess which you can see in the molar, because it is a lateral abscess which is situated between first molar and the second molar. Okay, so how do you plan treatment for this particular case? So does the emergency phase involved in this particular thing? No, there is no emergency in this, because if it is a really painful condition, because this looks like a chronic periodontal abscess for me, looking at the features of the abscess. So when it is acute periodontal abscess, the most prominent portion of the abscess, you just give a nick of with the blade, so that the drainage of an abscess keeps happening. So you give an opening for the abscess to drain on its own, and then put the patient under antibiotics. In a chronic periodontal abscess, you need not drain that particular abscess. So what you can do, you can either go for circular drainage of an abscess if it is associated with and it involves all the phases of treatment, that is non-surgical phase of treatment, and then goes with the surgical phase of maintenance therapy, and then goes with the surgical phase of treatment, and if it is necessary, go for restorative treatment as well as again maintenance therapy. So the patient has to be maintained for years together for the maintenance of oral health. Okay. And so the surgical, the initial phase, that is etiotropic phase, eliminates all the etiology, because abscess, what is the cause for an abscess? So abscess could be caused by a sharp object, or a fish bone which is into the surface, or a calculus piece, any of these things, or hair follicle, all these things can cause an abscess. So eliminate that etiology first, then give it a chance for healing, then proceed with the other treatments. Okay, thank you.